Let's take you to this now. Veteran medic Professor Taole Mokoena is the new health ombudsman. Professor Mokoena replaces former Ombud Professor Malegapuru Makgoba. Health Minister Dr Phaahla welcomed Mokoena as he starts his 7-year term.
A pleasure this morning to announce that Professor Makgoba will be succeeded by the gentleman I did not introduce, Professor Emeritus Professor Taole Mokoena. His appointment is with effect from yesterday, the 1st of June, so he's already wearing the boots of health ombuds. If you check his feet, you will find the boots will be that of a health ombud. Now, Professor Mokoena is one of our outstanding South African medical scholars who has transcended the globe to show the quality of South African academic prowess.
I come with a fresh mind and fresh blood. I hope that we're going to elevate his work to a higher level, because indeed the office of the Ombud is a big challenge. It's a big challenge for a variety of reasons, not the least of which is not the difficulties that the healthcare system is undergoing currently. It is under pressure. We have limited resources, and yet we have a growing population in the country. And as the population grows, some of the gains of the healthcare system is that people live longer, and therefore they consume healthcare resources longer. And for that reason, it's very difficult, given the economy of the country, for the country to provide timeously for this growth of the demand.
All right, now let's get a reaction to the appointment of the new health ombudsman. We're now joined via Zoom by Professor Alex van der Heever, Wits School of Governance. Prof, thank you so much for your time this afternoon. Well, what is your reaction? Is Professor Taole Mokoena the right person for the job?
Well, the Daily Maverick has published an evaluation of him, and the main concern that's raised is whether or not he will be independent. And the position requires two things. One is competent technical knowledge of the health system, and the second is the independence to be able to investigate public organizations without fear or favor. And what that means is you must have no conflict of interest with any party politics, any part of the political system, and any commercial interest. And what we see is that this appointment he has links into Chancellor House. He's very embedded in the ruling party, the governing party's various interests and structures, and looks very much like a party insider. And this is not what you want in a position like this. Parts of our public health system have been hollowed out and basically fallen into ruin as a consequence of the failure of accountability structures. And the office of the Ombud is itself an accountability structure, and it must stand apart from these structures. So if there is the possibility that there's going to be political embarrassment that results from an investigation by the Ombud, the question now is whether that will actually, whether a proper investigation will now occur. And that's why you cannot have people who are conflicted in such a position of accountability.
So, Prof, in short, he is not the right man to do this job. But let's talk about his credentials, though, and see how that weighs up to your concerns. I mean, we know that, of course, they seem, and that's his qualification at least, seem to be in line with this role. You know, some of these include a fellow of physicians in Glasgow. He was the academic head of the Department of Surgery and a former chief of surgeon of the Department of General Surgery at the University of Pretoria, as well as the Steve Biko Academic Hospital. And I don't know if you've heard that clip where he was basically talking about the responsibility that this role is, you know, talking about the fact that, you know, he comes with a fresh mind. The office of the Ombud is one that has significant challenges. Does this still, you know, not convince you enough that he is the right guy?
No, so you can have a chartered accountant who's appointed to do an external audit of a company, and yet is a shareholder in that company. It doesn't matter what their qualifications are, they're not appropriate to perform that function. So this is, in part, the Office of Health Standards Compliance has an audit function. Everybody in the board is appointed by the Minister of Health, which is problematic in and of itself. And the Ombud, the Office of the Ombud, is appointed by the Executive of Government, by the Minister of Health. So it's the conflict of interest that essentially undermines any technical qualification the person could have for the job, because essentially you could decide whether or not you turn off the tap when you want to. So what you really want is somebody who definitely understands the clinical context and the medical environment, but who's also prepared to investigate thoroughly what is going on when there are complaints that have been raised. Now, Professor Makgoba did that. He excoriated the departments, various provincial departments, and his closing analysis of the public health system is a devastating evaluation of the failure, systematic failure of multiple provinces apart from the Western Cape. And the question is now, with a political appointment in this position, are we going to get somebody who's going to make that kind of evaluation? Because that's what accountability is. Now, the issue is, it's not that the office itself has challenges, it's that the public health system has challenges. And part of what the Office of the Ombud is meant to do is to address those challenges by making sure that that people are held to account for anything that fails within that system so that you can correct it. But if you have somebody who's going to sweep things under the table, then you're not going to have a corrective. So I think that the fresh mind that people need in South Africa is not the Office of the Ombud, but it is the public health system. And the question is, are we going to have the correct kind of action from the Office of the Ombud in the future? I'm quite doubtful, because his links into Chancellor House and ANC investment companies, which everybody knows are tied in to raising funds for the ANC, and other offices that he's held, suggest that he is very much a party insider, and this is therefore the wrong kind of appointment. And South Africa has many highly qualified academic people in health sciences who would be very independent and extremely competent. Why choose somebody who has a conflict of interest with a political party?
I've actually read the article that you are referring to, and I see some concerns around the professor, also going back as far as 2002. What then would you recommend, Prof, as the way forward? I mean, this is a new appointment, and of course, as you've rightfully said, he does come after Professor Makgoba, who's been hailed pretty much in terms of what his role was and how he undertook that role. What should then happen now?
It's very difficult to say, because what it potentially implies is that the Office of the Ombud ceases to be part of the accountability system. It becomes what I would refer to as fake accountability. It's the veneer of accountability. Yes, we've done an investigation and everything's fine. And as that article points out, that there's obviously severe embarrassment that has resulted from the independent evaluations of Professor Makgoba. And the question is whether that has become tiresome, and that now what we are going to have is whitewashes. And so we can basically say that this part of the accountability structure just falls away. So it's not clear what can be done, because the whole purpose of such an office is that they do investigate independently. And if they're not going to do so, then they have no purpose.
Prof, thank you so much for your analysis. I really do appreciate you coming through onto the show. All right, Professor van der Heever is Wits School of Governance, Professor Alex van der Heever there.